Hello there. Welcome to Ensuring Your Well-Being. I am Dennis James, the biking, dancing insurance man with various insurance planning. And today I have two amazing ladies that are going to really bring a topic together that sooner or later we're all going to be a part of. We're going to notice one way or another, right? And so it's important to have experts. And first of all, I have two beautiful looking ladies from Hospice of Michigan. Okay, that is their calling, and they have a lot of experience. And so I'm going to start with Julia Capra. Is that correct?
That's right.
Julie, go ahead and just tell us a little bit about your background.
I'd be happy to. Thank you so much, by the way, Dennis, for having us both. We're honored to be here. I have been an advocate in healthcare for many years, and I am proud to say I'm serving in my 8th year now with Hospice of Michigan and North Star Palliative Care, helping those with life-limiting illness. And it's very important work, and I truly do enjoy it.
Yeah, and you've been doing it how long?
I've been with this organization now. I'm going on my 8th year.
Wow.
Yeah.
Okay.
And in healthcare for many years prior to.
Yeah, right. So, you've been around the block on this, and
Yes.
you're touching a lot of families and lives,
Yes,
right? At a special time.
Yes, very important.
When there's a real need. Okay, and we have Michelle. Go on, Michelle. What's
Thank
your
you.
last name?
Mihail. Mihail.
Simple.
It kind of has a sing-song quality to it.
And
Some of my residents that I work with, my patients, they say it has a musical quality. I said, well, parents, you did a good job. I have been in senior healthcare a long time, 20 plus years, and I am also very honored to be here today, honored to represent an outstanding organization, Hospice of Michigan, North Star Palliative Care Group, and we are a nonprofit group. My background is senior care, assisted living, memory care, home care, lots of different things in my career tenure. And a culmination of all those things brings me to Hospice of Michigan to serve seniors at the latter part of life, and very, very celebrated time for people. And I am honored to be here.
thank you. And and you were in California for a while, I believe.
Early in my career, I loaded the car and drove to California, Northern California, and was one of the first, part of the group, the team that was developing the first memory care assisted living in the early 90s. I won't date myself too much there, but we were one of the first facilities for that type of living, and now, of course, it's grown over these last 30 years to be an amazing option for folks specifically with memory impairment. And so it was an honor to be a part of that early team in the early 90s.
For sure. Wow. Okay, so let's get right down to, maybe start with the basics.
The basics.
But it's not basics for everyone, right?
Right.
When they hear the word hospice, they think it's the end of you're on your deathbed, but I believe that's not really totally true. But Julie,
There's a lot more to it. That's right.
Right.
That's right. So first, we'll dig into the origins of hospice. Maybe we'll go into a little bit of the history of it. The word itself actually is Latin for resting place for the weary. So hospice, or end-of-life care, as it is known, is a service for people who have what we would call a life-limiting illness.
Yeah.
And a limited life expectancy, or prognosis, is the medical word for life limiting. So there's a number of different things that we would consider life limiting. It's many different ailments, whether it be the ones that most people think of, like cancer, or perhaps an advanced heart disease, or something like a congestive heart failure, or maybe a pulmonary disease like COPD. But there are many other life-limiting illnesses that we work with people that they're dealing with, such as, let's say, ALS, MS, things that are definitely put a limit and help, are very stressful for families and patients. So it's not really about the diagnosis. It's really about when a patient hears that word or gets news that they have a limit on their life.
Mm-hmm.
There's a whole team of people that move into it. But again, going back to the history, hospice has been around since the beginning of time. Early man, when we were wandering the desert, maybe there was always a nice person that stayed behind in a hut and took care of those who could not go on. There's historians have records of these types of things, and that's where the word originated. Again, long ago, it's from a Latin derivative, resting place for the weary. However, in medicine, Medicare did not start reimbursing the nice people that do this work until 1983, which is like yesterday for some of us.
Right.
And so it really hasn't been that long, but as far as it being a formally reimbursed Medicare benefit. However, groups like Hospice of Michigan were some of the early providers of this work. We were volunteers. There was a group of volunteers, and we are proud to say we were the originators here in this area. There was a few groups across the country. There was a wonderful woman named Dame Cicely Saunders, who was a nurse in the 40s, and she created what we now look at as the modern hospice model. She created St. Christopher's House in London. She was a nurse, then she became a social worker, then she became a physician. She was very interested in end-of-life care, working in hospitals and watching people that were very sick and dying get treated. And she saw people suffering. And so she really, as a one-woman show, created the modern hospice model with St. Christopher's House. And we followed suit in late 1960s. She created St. Christopher's, and the word spread to the U.S. in the medical community. And we all started to sort of band together as volunteers and created a network. Hospice of Michigan was established about 40 years ago officially. And we're proud to say now, of course, since 1983, Medicare, Medicaid, and private insurance honor the hospice benefit.
Right. And so is it throughout the U.S. then, or is it national? Or
it is
what?
International. It's an international service. The movement, again, it was formally started by Dame Cicely in London. And but we're proudly here in Michigan, Hospice of Michigan is the oldest and largest not-for-profit.
No kidding.
Yeah.
All right, so let's, that was good.
Thank you.
Michelle.
Beautiful.
Little
beautiful.
Why
history.
don't we go to the next step as far as, what is palliative care and how does it differ from hospice?
Well, that is a very specific question that we often find ourselves entertaining with different families and patients. Palliative care is supporting the symptoms that those folks are dealing with their life-limiting illness. So we are supporting their symptoms in a way. It can vary. They can be at home, they can be in a hospital setting or maybe a senior care setting, but we're mainly supporting those issues there.
The symptoms, yeah. So
The
let's
symptoms.
say we had a diagnosis and you wanted to continue treating your illness, and you didn't want to forego your what we would call
Don't treat it
aggressive
anymore.
treatments, right? So let's say I wanted to continue to go to my neurologist. I wanted to continue to go to my cardiologist. I wanted to continue to go to my oncologist for treatment for whatever my illness was. Palliative care would be appropriate for those
follow you.
people. So it's not hospice care. It is symptom management. Like Michelle said, we're there to help with symptoms, but it is not hospice care. So it is more just focusing on the symptoms as an addition to the patient's other specialties. So you're not, it is not as robust a service as hospice.
So is that a conversation between the family and you?
Yeah, Michelle and I certainly are talking to
that's
families,
what I
and
mean.
also maybe a physician would recommend palliative care, and really mean hospice. So that's something that we're going to circle back to. Hospice is a form of palliative care. To palliate or to bring comfort is a lot of different types of medicine, right? So palliative care in the community can mean a lot of different things. How we deliver palliative care is going to be different than maybe how another organization delivers it, or even maybe a hospital might deliver it a little bit differently. So it can mean different things. It can be very confusing for the end user. And so physicians might say, you know what, Julie, I'd like to talk to you about palliative care. And she might mean hospice. So we have to get very specific. And that's why Michelle and I are out here giving this information and educating people on the differences.
Right.
But palliative care in the community, like Michelle said, it's symptom management when somebody is still seeking aggressive care.
Okay, and I'm just like looking at do people have to be at the end of life to enroll?
No,
They
Not
don't.
at all.
no. For palliative care nor hospice, it depends on, this is a heavy question. Prognosis is a difficult thing. If a doctor is going to look at someone with a significant illness
Yeah.
and say, okay, let's say I'm the patient, Julie,
Yeah.
you have X disease, and
Right.
that doctor, he or she may look at data that says somebody with my disease lives an average of X number of years
Got it.
with X number of treatments. And so it's really difficult for doctors to prognosticate or tell us
Mm-hmm.
how long we're going to live. And oftentimes it's almost like a genie looking at a through a magic window. We don't have that. We don't have a crystal ball. They're often wrong with prognostication with disease. We've all heard stories. You have 2 years and they live for 2 days.
Right.
You have 2 days and they live for 2
Right.
years. So anybody can talk to us about hospice, and that anybody can inquire and ask questions, or palliative care. Sometimes with palliative care, people only see us once and we help with the symptom, and then they don't talk to us again,
Sure.
and they're doing great, right? So it's a different service altogether. Symptom management
Right.
and hospice care is a lot more of a robust wraparound service.
Yeah, you make that clear, so I appreciate that. So, all right, how does, from a patient and family support, Michelle, how does hospice address the emotional needs of patients and their families at difficult times?
Well, we like to look at a multidisciplinary approach. So, not only do we have a physician that may follow them, we have a nurse, an ongoing nurse that forms a relationship with that patient. Then we have other areas such as music therapy that could be
Yeah.
going into the home if the person particularly loved music, which so many
Right.
of us do as the universal language. We support them with that. We also support them, very importantly, with a social work component. So there is a social worker professional
Yeah.
that is part of their team. So, you come back to that word team over and over because it really is for palliative or hospice care, really both hand in hand. It is a team interdisciplinary approach.
Right.
And I think that's crucial. I don't think families and patients always realize that it is a group that come together to support their end of
So
life.
that's a connection between somebody like you pulling it together for the family wherever they are.
Yeah, we're the person that families can meet with, whether they're at home, in the hospital, where they meet us in an emergency situation, and they would, once enrolled in hospice, meet their team. And so, like Michelle said, for that psychosocial support, that social worker
Yeah.
is a crucial piece, because we are multidimensional. We're not just a physical body suffering. There's a whole lot of emotional and spiritual,
Absolutely.
psychosocial suffering when we're given news that we have a limited time.
Yeah.
There's
Yeah.
a definite need. We actually, going back to Dame Cicely, she created the concept of what is called total pain, that would include the physical pain, the emotional, psychosocial, and spiritual pain. And all these practical issues come up when we're faced with potentially end of life, whether it's in 6 months or 2 years or whatever the time span is. That whole team
Yeah.
needs to be mobilized
Right.
for that patient and the family.
Yeah. Well, I remember, going through it with my mother,
Oh, yeah.
and it was a blessing, with all the services, when they told me about hospice and where we were headed with that, and they, any kind of meds or whatever it was, but, she had a great life, but the support there was amazing, which, for sure made a difference for me and my brothers and, any other family members or somebody close to her.
Yeah, that's an
And-
important point.
yeah.
A lot of people
Yeah.
think it's just about the patient. It's a family affair.
Yeah.
And sometimes
Yeah.
neighbor, there might be somebody that's other than family that's very involved with that person, that's been looking after somebody. And again, a lot of times it is a friend or a neighbor. We
Yeah.
consider all of those people family
Right.
when we're supporting the patient and their support system.
And then as kind of grief counseling, brethren support for the families after a patient passes.
Yes, and
So
not only
that's a
after the patient,
continuation.
but I'm proud to say it's if there are needs prior to the patient passing, we can involve our grief support counselors prior. There are sometimes what we would call complicated grief situations. And we're really proud at Hospice of Michigan, again, being a not-for-profit, we have a very robust grief support program, and we have ongoing counseling that's available, and we can make that information available to our viewers and listeners too, but they can also go to our website. But anybody suffering a loss, whether they've been with hospice or not, can tap into our grief support programming, and it's free. So we have grief support groups. We of course can reach out to our patients and families one-on-one with grief support, but these groups for the family members after the passing, they're so helpful.
Right. Yeah, they're pretty much, I think, even in the Orient Center, they are set up in the local communities, right?
They're so important. Grief
Adult
support.
daycare,
Yes.
You have anything to say more, Michelle?
Well, I was just going to expand on that grief support, whether they were with us on a hospice or palliative situation, goes on after the patient might pass or the loved one may pass. And so how long does that go on? And, it can go on, but minimally 13 months, because we look at all those firsts that happen after the person passes that first year. And you've got that family that's grieving differently, but you've got holidays and birthdays and different things like that. And so it's really a crucial, vital piece to that family. And being Hospice of Michigan being not-for-profit, it really is available across the board to all family members and people involved with that initial patient. So I just think that's vital to mention.
Yeah. How many people work I'm just curious, at Hospice of Michigan?
Hospice Michigan and our associated hospices, because we do have two partners in caring, two other not-for-profits that are associated with us, Arbor Hospice out of Ann Arbor, serving 5 counties and their surrounding areas. We also have Centrica Care Navigators. They're based out of Kalamazoo, also serving 5 counties around the Kalamazoo County area. And they're wonderful. We just joined forces with them quite recently. So serving all of Michigan right now, we have about 1,000 employees. It's a large organization. Yeah. And we are caring for over 2,000 patients with our hospice and palliative programs together. I think it's around 2,600 patients today.
So are they under their own umbrella then?
They're
Arbor?
they're our partner. They're under the North Star Care
partners.
Community umbrella.
I've heard of that.
So we are joined with them. However, we have maintained, all of us have our own identity. So Arbor Hospice is still Arbor Hospice, and Centrica is Centrica, but we are all part of the North Star Care Community with Hospice of Michigan. Yeah.
Well, everybody likes the Northern Star, right?
Yes,
Isn't that a
it's
beautiful
wonderful.
image?
Yeah.
It's a beautiful image.
All right, let's talk anything more there, or if not, I'm going to go into the medical aspects of everything.
Well, go ahead. Please ask us questions.
Okay, so what kind of medical professionals are part of the hospice team? I know we briefly talked on that. Family, hospice team regarding treatment. Nurses, doctors, social workers, that type of thing.
Social workers and another member of the team. So hospice physician, a family's physician. So Michelle and I both are very adamant to make sure if a family would like their community physician to be involved, we welcome that.
Right.
We do. And so as part of that team, and so also part of that team as a hospice aide to help with bathing and grooming. If that becomes difficult for a patient, we offer that service as well. That's part of your team. And then, of course, spiritual care. Yeah. We like to we like to highlight that. That's a very important part of the team, that we suffer spiritual pain. And that spiritual care coordinator, there is one on every team. That is actually one wonderful thing that Medicare did when they helped set up this benefit with us as hospices. That is part of every team. Wow. So whatever hospice across the board, there's spiritual care as well. And we also have trained volunteers. So let's say a patient is interested in having visits. And there's many beautiful stories about our volunteers, but these are trained. This is a very vigorous program. And I know because I am a volunteer with Hospice of Michigan, and it is a vigorous training program with good reason, a lot of good education about how to approach a patient and what things to say and things not to say. And there's a lot to it. So a lot of great education, but those volunteers are trained to sit by, whether it's companionship or perhaps somebody with an interest in music like Michelle.
Yeah.
We could maybe sing or read
Yeah.
to a patient if somebody's lost their eyeyesight and they still
What
love
song
to
you
read.
want to sing, Michelle? Do you have a certain song you want to sing?
Oh, I always have an arsenal of songs at the ready. At the ready.
At the ready.
Perhaps we'll
Okay.
culminate at the end
All
with
right.
a little hymn or
Okay.
something.
All right.
But the volunteer program is robust at our agency, and that is something that we can offer to families. And sometimes our patients are lonely and isolated, right?
Yeah.
And so having volunteers stop by, but the team approach is vital for that
Yeah.
patient's well-being and for the family too. Oftentimes, that volunteer is the one person that's giving a family caregiver a break so they can run to the store or maybe go to the library and just be alone and have time for themselves. This is, again, it is a family affair.
Yeah. I get how music, is so important, right? I mean, me with my background in dancing, right? I mean, when I would go into American House, I mean, just bring a lot of joy to everybody, just like with a little, whatever it was, simple dance or whatever it was, with the music. And I have a close friend, husband and wife, right? Ellen and Donna, and they probably, I think they did like over 200 or 170 or 200, just like throughout the year. Of different plays. She plays violin, and he's a organist. They don't really sing, but they're up there in age, and he retired from Chrysler, and they go into all these locations.
Oh my
That's
goodness,
how
we'd
they
love to
give
talk to
back.
them about volunteering. For
Yeah,
them.
yeah, right.
It really is. Music really,
Yeah.
I've seen it firsthand over the years.
Yeah.
It really is a universal language. You
Yeah.
can be working with a patient
Yeah.
or a resident that hasn't spoken perhaps a cohesive sentence,
Right.
but put on,
Yeah.
Sweet Caroline, and
Right.
they're singing, Sweet Carol, and they know
Right.
all the lyrics, they know all the words,
Right.
and so it's a universal
Yeah.
way
Go
to
ahead. One more
reach-
time with that, right?
Oh, Sweet Caroline, do, do, do.
That was perfect.
Got to keep it light. You
All
gotta
right.
keep
Yeah,
it light.
I think we're doing that, aren't
Yeah,
we?
we are.
We have to. This
Gotta
is
bring
this is heavy
laughter.
stuff, and we want to make this approachable for
Okay,
everyone.
and how does the hospice collaborate, with healthcare providers and coordination for patients and that type of thing?
Well, there's many ways that we coordinate. First and foremost, hospitals will reach out directly to hospice organizations and
Yeah.
say, we have a situation. Physicians will make a referral for the service.
Okay.
And we collaborate with it from our department, so to speak, as hospice advisors.
Okay.
Michelle and I will reach out in the community and provide education with programs like this.
Yeah, I love it.
And
That's
we
great.
will also go, whether it's to nursing homes, senior centers, we
Yeah.
provide educational modules to people. We do professional training.
Yeah.
So we offer, as part of our not-for-profit mission, we do continuing education for nurses and social workers. We're offering something coming up in Waterford on the 29th. We're doing an event with Canterbury on the Lakes. Can we say that?
Yeah.
And we're having a
fine.
CEU event, and we're inviting social workers and nurses to come. And it is a requirement that they annually stay up to date with their CEs, with their continuing
Yeah.
education units. And so we offer these in the community for professionals, and then we offer education for the end user or for family members too, just to make sure that people understand what the service is and what it isn't, and to try to take some of the fear away.
Right.
Yeah.
Yeah. It's funny, you're talking. I'm like, my brain is going all over the place with
Yeah. Well, there's
all
so
the-
much.
all
so
these things
much.
you can help and create, right?
Yeah. Yeah.
To bring everyone together.
Yeah.
Right?
And truthfully, I think that helping take some of the fear out, people really do have that misconception
Mhm.
that hospice is for your final days. It's for the last 3 days. That is not true. And one thing that we do, we would like to mention, we offer pediatric hospice. We don't like to talk about this subject. That's a heavy subject, right? But it's
Absolutely.
very important. And
Yeah.
thankfully, there are not a lot of pediatric patients on census. But I'll tell you, when that's needed,
Yeah.
that's a very specialized group of
Huge.
professionals. And we are proud. We have
Yeah.
the Joe Ellen Nyman Anchors Program for Children.
Wow.
And we surround those families and patients with some very specialized care. And our pediatric program goes up to age, I believe it's 23,
Okay.
that we consider patients to be PEDS patients in many cases. And
So from being children to
yes.
okay.
And I'm also going to say a
children.
perinatal program too. We help people
Yes, no
when they
kidding.
get bad news
Yeah.
prior to delivery, and we
Right.
come in, and that is
Yeah.
very specialized, and a lot of social work support is needed for that. And
Mm.
again, that's important work, and that is from generous donations that we are able to support a lot of these programs, and we can get into that. We have other programs too, but that is not often supported by insurance. So
Okay. Yep. And so how does hospice manage pain? Well, we talked about that, pain and symptom management.
yeah, symptom
for pain.
management, again,
Yeah.
specialized
Yeah,
care.
you said that. I love
Yeah.
that. How you separated them
Yeah,
too, right?
different
So,
types of pain, but really how it looks is a nurse will visit with the patient, typically weekly, more if needed,
mhm.
and we will get to know that patient and that family, and we get to know what's going on with
Yeah.
them, just like their primary care physician had previously. We become the primary care physician,
Yeah.
and sometimes we have relationships with patients and families
Yeah.
that go on for years.
Yeah. I could imagine.
And sometimes people graduate. A surprising number of patients, I think the number was very surprising. I think it was between 13 and 16% of hospice patients actually graduate and go back to their primary care physicians. This is a national statistic, but that's a surprisingly large amount of people.
I would think so.
Yeah, and they actually
happens.
graduate from hospice. It does happen. People normalize, they get better. Maybe their
Wow.
symptoms are being managed really well at home.
Yeah.
We're taking good care of
Yeah.
them. They feel supported, and they stabilize, and they no longer actually qualify for the benefit. So we can't keep them on service if they don't qualify. And again, that's a small group, but
Small group, right?
but it happens. Yeah, but
Yeah.
pain is very, very pain and nausea and all these other symptoms that can be so distressing for patients and their caregivers.
Mm-hmm.
We are there to make sure that we're supported. And please know, hospice is open 24/7. So if there are symptoms that arise in the middle of the night, which happens frequently, we're a phone call away.
Yeah, that's so good.
And you can get a nurse on the phone
Yeah.
any time of day or night. And the patient, let's say the patient wants to talk about what's happening, they can call us. We have technology now where we can do video visits with our patients at home, and they can actually call us up on our virtual team, and we can lay eyes on them in the moment.
Wow.
It's amazing. And of course, dispatch a nurse is needed.
Mm-hmm.
Yeah.
I think sometimes that middle of the night kind of pain management or different events happen, and it's always so frightening for our families, caregivers, patients, and to have that availability with our organization, that
Yeah.
24/7 availability in multiple ways, multiple facets is key. And I'm very proud of that with our organization.
Yeah. And also, can we touch on some things that are included with the Medicare hospice benefit?
Absolutely.
I just wanted to mention that it includes your team, of course, but also the medical supplies that are needed, and also very importantly, the durable medical equipment, the equipment needed. Maybe there's a need for a hospital bed, wheelchair, things
Yeah.
of that nature, walker,
Yeah.
and other equipment as well. So
Support equipment.
that's so important to know that that's all covered under that benefit.
Right. Yeah. Yeah.
There's no cost.
Do people donate things a lot too, or
Well, we actually
or
people
I know
make
a lot of times insurances will pay for those.
yeah, insurance
services.
under the Medicare benefit, all of that equipment is covered.
Yeah.
We accept donations for our not-for-profit mission, again, like that children's program I talked about.
Mhm.
There's something else I'd like to mention. There's a couple of other programs. We call them our programs of excellence that sort of go above and beyond the average. But we have a program called Open Access. Open Access will help cover patients that may be uninsured or underinsured. And these are things that people don't often think about, that there are people out there
Right.
that don't have insurance.
Right.
We will care for them. And we raise money from our generous donors
Okay.
and supporters, whether it's corporate or private individuals that are donating to us.
Right.
So all people are covered with
Mhm.
hospice care. This is medical care. It's a certified medical benefit,
Mhm.
but those who don't have the proper coverage deserve a dignified end of life as well.
Right.
So we
And
care
we-
for those people.
Let me add to that, Julie. We also go to them where they are.
Right.
We have served people in various locations in various situations, and we are very passionate about going to meet the patient where they are.
Yes, that is a key element. Thank you for that. our overreaching standard is every person, every time, no matter who they are and what their circumstance. So it's all people, regardless of their age, hence the children's program, their diagnosis, or their financial circumstance. We are there.
Mm-hmm.
So
So community outreach, we've pretty much covered where a lot of things are. We're going to wrap it up in a few minutes.
Yeah.
But anything you'd like to say, both of you, either one of you, in reference to what we haven't covered? How's that?
I would like to mention just a couple of other things regarding to quality of life and things that we offer above and beyond the typical hospice benefit as a not-for-profit. So
Right.
we are very involved in the We Honor Veterans program,
Mm-hmm.
which helps to connect families and patients that are veterans with wonderful services through the VA that they might not know about. So
Wow.
we also do beautiful bedside veterans pinnings for our vets that are, it's very meaningful for them to be acknowledged.
Wow.
As you know,
Yeah.
a lot of people from different generations maybe weren't celebrated when they came back from active duty.
Right.
Certain wars, most certainly we know
Yeah.
Vietnam, there was a lot of controversy, unfortunately, and people weren't properly thanked for their service. And we make a point to reach out to families and patients when they are a veteran, that we can offer that. And we've done small bedside pinnings when somebody is unfortunately bedridden. But when a patient is still able to be up and around, we'll throw big parties with the families, and we'll bring our whole team in and acknowledge them that way. And that's deeply meaningful for the
Sure.
vet that maybe
Yeah,
in the
I can
past was
imagine.
not acknowledged.
Right,
And
I
that's
love
something
that,
we're
right.
very proud of. And also our integrative therapies, services like music therapy, that's not covered by insurance. We raise money to
Okay.
cover that. And those are master's level music therapists. They're not just entertainers like we are, but these people are certified music therapists. It is a medical modality that
Right.
can help ease pain,
Wow.
stress. It helps, obviously, with
Wow.
people, as Michelle mentioned,
Yeah.
with dementia. And so those are really important. And I also want to mention our Gestures of Grace Fund. We have a special fund that we hold for patients that might have a specific issue. I had a patient, she was in a different county than Oakland, but she needed
Mhm.
help. She was planning to die at home. She had
Mm.
family coming and helping her with caregiving.
Mhm.
But guess what? Her heater went out.
Mm.
And so our Gestures of Grace Fund paid for her HVAC bill so she could stay at home through end of life.
Wow.
So these are some things that are a little bit different that I
Right.
like to mention. We are not Make-A-Wish. We're not sending people to Disney World, but
Right.
sometimes we'll have a patient that have loved ones that live across the country and they
Right.
can't afford to come in.
Yeah.
We've also bought some plane tickets so families
Wow.
can say goodbye.
Wow.
So to that, we have an annual fundraiser called Barley Barbecue and Beats. It's coming up in April. It's April 25th at St. Andrews Hall in Detroit. It is
Okay.
a festive, fun, blue jeans and T-shirts kind of event. People
Mhm.
can buy tickets to that to help support these
Okay.
wonderful programs.
Yeah.
And so I just wanted to mention that. And that
Yeah.
information can be found on our website at HOM.org.
Okay.
And we would love people. We're also always looking for sponsorships from corporations to
Okay.
step in. Again, we can't do this work
Right.
without generous donors,
Right.
whether it's private or corporate.
Right. Any final words there, Michelle?
I just have actually attended our fundraiser in the past, and it is a very good time where you see not only families and professionals, and it's really a culmination
Yeah.
of all the work we do while
Yeah.
we're raising the money and the funds that we do need to continue our work.
Okay. Well, you ladies were amazing.
Oh, you're amazing. Thank you for
No,
having us. on
I
this.
just want to say that. So, to wrap it up, if they had questions,
Yes.
Julie, and then I would also like Michelle to go
Yeah.
ahead and give your.
Well, our information,
Yes,
sure. And
please.
and we encourage people to visit our website again. It is HOM.org.
Okay.
HOM short for Hospice of Michigan.
Mhm.
People can always call our 24-hour caregiver support center. This is
Okay.
important to say again. 24-hour caregiver support center.
Mhm.
They can call and ask questions. You can talk to a nurse right away
Okay.
and ask questions or set up an appointment. So I'd like to share that number is 888-247-5701, and perhaps you can put that up for the viewers. And again, I'll repeat that, 888-247-5701. 5701. It's our
Okay.
24-hour caregiver support center hotline that is available for anyone with questions, concerns, just want to find out more. They can
Right.
get to Michelle and I through that number.
Okay. That's
People
good.
can always
Yeah.
say, I saw this on a podcast or I heard this on a
Right.
podcast. But that number is 24 hours. They can get a real live person to
Okay.
talk about
Right.
hospice or palliative care
Okay.
or find out about Barley Barbecue and Beets. Again, they can go to our website at HOM.org.
Okay. Anything more, Michelle?
Just very grateful that you invited us here
Yeah.
today and that we're able to get this
Yeah.
information out to the world.
Yeah.
Community service piece is
Yeah.
a passion.
I
That
get
is
it, you
Tremendous.
know.
Thank you for supporting.
Thank you.
Yeah, I'm just really impressed with both of you because of your expertise. I mean, it's, all things happen for a reason, right? There's no mistakes. And, we each have a calling, and you two are fulfilling it in so many ways. And so thank you.
Very kind.
And
Thank
have a great day. And God bless everybody.